My name's Alex Scott. I'm the branch secretary of Together. I'll be conducting today's public service briefing in relation to COVID matters. While we'll be normally doing a monthly briefing on a range of matters in relation to public service, today's briefing is specifically in relation to a variety of issues in relation to COVID. Before we start, I'd like to acknowledge the traditional owners on the land which we're meeting across the state and pay my respects to their elders past, present and emerging. We will try and keep today's session to just on half an hour, and we will be hoping to be able to get through that within the half hour. Sorry, just trying to get this technology out. And we'll be trying to get through all the processes through the chat and cover most of the questions. There will be some questions that people submitted beforehand that we won't be able to cover, but we'll come back to those individually after today's meeting. We're still getting a few people joining, so I'll just slow down before I start, and I'll apologise in advance if I speak too quickly. So in terms of, before we get into the details of what's happened over the last couple of weeks, just kind of, I think it's worth briefly touching base about what happened in the last month or so of 2021. So that kind of puts to what's happening in terms of 2022 into context. So during 2021, we had a series of vaccination mandates in relation to COVID, both introduced by the employer and also some that were introduced as a result of Chief Health Officer mandates. In terms of that time frame, the initial round of vaccination mandates in the public sector in Queensland were in relation to the Queensland Health System and the Queensland Police Service. They were both initially employer mandates, where the Police Commissioner and the Director General of Health, after consultation, introduced a mandate that required all employees within their two services to be vaccinated, fully vaccinated, to participate, continue to work. Following that process, which was quite a long process, it was quite a rushed process in November, December, following a period where we had the Chief Health Officer moved to become Governor, then we had an acting Chief Health Officer, and then we had a new Chief Health Officer. That, combined with the opening of the borders, meant that we went through a period of stop-start processes around consultation, and particularly in relation to whether there would be Chief Health Officer mandates as opposed to employer mandates in relation to vaccinations. Some of those were introduced in relation to trying to encourage vaccination rates within the broader community, so particularly in relation to pubs and clubs, and some of our members got caught up in that process in relation to Art Gallery, Museum and the State Library, although the definition of State Library has expanded a bit. And so there was a reasonable number of our members, Together members, caught by the requirements to be vaccinated through that kind of process. And then after that, and that was quite a delayed process, was announced well in advance, but then issued very close to the date of the borders opening. Following that announcement, there was a process whereby there was kind of a discussion in the media, particularly around whether or not the vaccinations would be required by the Chief Health Officer beyond that. And that got a bit confused around the mandates for visitors to prisons. But just before Christmas, there was a further round of mandates. One was in relation to public and private health. And that then meant that all hospitals, both public and private, had an extended mandate required. And so our members in Queensland Health were both covered by an employer mandate and a CHO mandate. And that CHO mandate also extended into disability services within the Department of Seniors and Disabilities. So that was a range of CHO mandates that came in. And then following that, there was a further round of CHO mandates introduced just before the end of the school term, which applied to Queensland Corrections, Schools and Youth Detention, with the dates around the requirement for vaccinations being kind of one vaccine before Christmas, but effectively having the introduction of the full vaccination rates mandate by the CHO being linked to the start of the school year, which originally was going to be this Monday, being the 24th, but then clearly as a result of other issues, that school hasn't come back, but the CHO mandate was in place in relation to schools, corrections and youth detention linked to that particular timeframe. As a result of that, and particularly around the challenges that the Together had in relation to inappropriate and failure to adequately consult about those CHO mandates, we went back and tried to work out, well, what were the lessons learned in 2020 and 2021 and how we could deal with that better in terms of 2022. And as part of that process, thinking not just about the issue of the vaccination mandate, but more broadly about workplace health and safety issues that will be facing our members. And we worked with members and delegates about what a strategy looked like in relation to that, and particularly what we'd be looking at in terms of how we should get better engagement from the employer about the issues that we'd be facing in 22 once the borders came down. As part of that process, we did come up with a policy, but what happened was just as the borders were opening up, we also then had the significant variation in the pandemic itself in relation to the underlying health issues in relation to the pandemic as we moved from the dominant strain being Delta to the dominant strain being Omicron, which was highly more contagious, but certainly was less of a health risk. That while Omicron is easier to catch, it has less impact in relation to the number of people who will die from it or end up in ICU or being hospitalised. That was also combined with the higher vaccination rates within Queensland, but certainly Omicron substantially changed what was going to be happening to us in 2020. But in the end of 2021, the process that we came with delegates and members was about developing a proactive response in relation to COVID and looking at trying to force agencies to consult, but also having an evidence-based decision-making process. And in late December or in early December, before the borders came down and before Omicron was on the kind of cards as a reality in terms of its experience, Together kind of put a proposal to governments and departments saying they needed to start talking to us earlier about these issues and a strategy about how do we actually make sure that workers were being consulted in relation to the challenges of the pandemic. And so while we had a broader strategy about the roadmap process, but beyond that, we were then seeking a series of key dates to try and force meaningful discussion with the employer, but with their staff and with union members in relation to what a mandate might look like, but also what might happen beyond the mandate in relation to that process. So that was really seeking that the government departments start talking to us over the Christmas period for real consultation and trying to force government and departments to make decisions about what their response was going to be towards COVID by the 23rd, which was the kind of key date for corrections and schools. But also in terms of at that point in time, the strategy was about a key date being when schools would be returning and there'd be a likelihood of more staff in the workplace. So that was our broader strategy and that process. And also then in December, in conjunction with that, rather than waiting for the employer to try and work out what they were doing, we started a ballot of members agency by agency, seeking their views as to whether we should be supporting or opposing vaccination mandates in each department. So in kind of mid-December, early December, we started that process, and that ballot has been continuing on the union website on an agency by agency basis as to allowing members the ability on an agency basis to determine what the broader policy response from Together should be about COVID, but also particularly about the mandate issue. Also in conjunction with that, we then also launched the Safer Together campaign, which was both an issue in relation to kind of providing some coordination about that agency response, but also seeking to ensure that any mandates were, if implemented, we were able to try and protect the rights of the individuals who chose not to be vaccinated, to ensure that they had appropriate capacity to have their rights supported by their union in terms of any disciplinary processes, but also in terms of exemption processes. But also then to move beyond the mandate question to a broader conversation about what the workplace health and safety responses from the government should be and how they should be consulting with workers as part of that process. So that was really where we got to by the end of school term last year. And that was really where we got to in terms of 2021. We'd launched the campaign, we put a claim against government on an agency by agency basis to try and start a conversation. And we're also kind of working through with members on an agency-by-agency basis your views in relation to whether the mandate is something that's appropriate or not, and then also trying to force government to consult more rather than making decisions. What then happened clearly in terms of the borders coming down was an explosion of cases. Some of that was expected in relation to even in the Delta days. There was an expectation once the borders came down prior to Christmas that there would be some movement of the Delta COVID virus from New South Wales, which had much higher exposure levels and cases in December and November. But also overlapping was the Omicron virus strain coming through in much higher numbers and much more virulent strain with much more higher case numbers internationally, and that then kind of emerged into Australia, both starting in New South Wales and Victoria, and certainly their peak is a couple of weeks ahead. But that certainly changed the modelling in relation to the number of cases and the severity of cases that were going to come through. The employer's response to that was a very rushed consultation process around a mandate, and rather than doing a mandate on a department-by-department basis, because that's where the power to do that really lies, with the Director General of each department has the reserved powers under the Public Service Act to allow them to introduce the mandate, and we've seen that endorsed both in the Fair Work Commission across Australia, but also with the more recent decisions in the QIRC in Queensland. So we know the employer had that power, but what they sought to do in a very rushed process in 1 William was, over the close down period, they wanted to introduce a mandate or to undertake a consultation process coordinated by Premier's Department and PSC on behalf of all agencies in relation to whether 1 William Street should have a mandate in relation to COVID and the vaccination process. So that occurred and closed on the 6th of January. And that process was, we participated in that, and in addition to the broader Together ballot on an agency-by-agency basis, we undertook a kind of quite a proactive process to try and find our members, a lot of whom weren't at work during this period, to try and get their views in relation to 1 William Street about whether there should be a mandate there. In terms of that process, clearly the support for a mandate was strong amongst the broader workforce in 1 William Street, but amongst Together members, there was a much higher level of support for a mandate in 1 William Street than there is in the rest of the membership, based on the kind of the early indications of our poll in relation to agency-based processes compared to the response in relation to 1 William Street, which had a much higher percentage at about 80% support for that. In addition to that, we then kind of started a consultation. A number of agencies then started to engage with us both before Christmas and then after Christmas about whether or not an employer mandate was appropriate for them. The two major agencies which weren't affected particularly by the CHO mandates, and there was some ripple effect in relation to youth detention into child safety, but also some of the art gallery kind of and arts areas into Cheddar. We saw both the Environment Department and also Justice and Attorney General start a consultation process, which is now completed, in relation to the possibility of introducing a mandate. In both those areas, Together members participated in that process. We made significant suggestions in relation to the structure and nature of the policies, but the members in those areas supported the broad concept of a mandate, and that's now been introduced by the Environment Science Department, has advised us that their consultation period has been completed and their Director General has introduced a policy in relation to that. Justice and Attorney General has completed their consultation period but hasn't advised us yet of whether the Director General will be introducing that mandate, although our Together members in Justice and Attorney General did make submissions about the policy. We broadly supported the notion of a mandate. Following them, we have a number of other departments who are towards the end of a consultation process. Resources, Agriculture and Fisheries, and Regional Development all were working pretty much in conjunction with each other, and their policies were put out a couple of weeks ago, closing today and tomorrow, with Regional Development being 24 hours later. And that process, where we are our members we're working through that process. We've met with the departments. The ballots are still open for members till the end of today, but the indications are that there is still significant kind of 70 to 70+% support for mandates being introduced, and we would expect that's likely to be where our members get to in terms of that process. And then we also saw the Department of Transport and Main Roads also starting their consultation process, which runs till next week. And they were followed by the Office of Industrial Relations. Fire and Emergency Services started theirs this week. We've had some discussions with the Department of Tourism, Sport and Industry, where there is some consultation occurring, but not for the whole agency. And the CCC has also started their process in relation to that. And where the major areas, apart from some of the smaller departments where we still haven't seen any clear indication about where they're going to go, is in relation to cheddar, in relation to non-schools education. So we've now seen OAR, Office of Industrial Relations, plus schools mandated by the Office of Industrial Relations mandated or seeking an employer mandate out for consultation at the moment. We haven't seen any education where education's at with either with the regional office or head office. But from a union perspective, we've started a ballot of our members to determine whether we should be seeking or supporting a mandate in relation to those rest of EQ, and we're still waiting to see where DESBIT gets to. The other major issue that's come up in the last couple of weeks has also been the issue in relation to the Novavax, the fourth vax now being available within the community, and this has a significant impact for a number of our members, particularly based on our experience in corrections, schools, and health and police, is that there are a significant component of our members who are unwilling to be vaccinated with the 3 vaccines that were available in 2021, who are pro-vaccination but have a different choice of vaccine for a variety of reasons. And so Novavax will be something that they've said they were waiting for. That has the implication for us as a union is, do we now seek to have the timeframes when they come in amended to allow people to get access to the Novavax? That was something we hadn't previously asked our members for, and so we were seeking some feedback from members today. And in terms of that, what we have got is that I think that's showing us, I'm not sure if you can see those results, but what it is showing is that there is a reasonable level of support from members for that there should be some capacity for people to access Novavax as part of that process. The other thing that we've been seeking to do is to have the pandemic leave directive reviewed. Clearly, the pandemic leave directive was issued in 2020 before vaccinations were available, and so we've got into a situation where there's been significant confusion about people's rights and entitlements in relation to pandemic leave. So you're entitled to pandemic leave for a variety of reasons, but not in relation to getting time off to be vaccinated or in relation to get time off in relation to the consequences of being vaccinated with side effects. That's under special leave. It's available for you as leave, but not under this leave directive. So we sought the employer to renegotiate that directive, and those negotiations occurred. There was a meeting this morning about that, and we'll provide some feedback about how those negotiations are continuing. But we are hoping to have that directive updated and made relevant for a 2022 Omicron environment with vaccination rates and other things being the key issue. We're hoping that will be the case. But I'd have to say that we've been trying to use our members to drive that debate, and we've had limited success at this point in time in getting members to support that in terms of the petition, but we are still trying to engage directly with the PSC to force an outcome, even though it doesn't appear to be a widely or deeply felt issue from members. Then in addition to that, we then have working from home, which was a confusing process in the public sector. What we saw initially was that a series of rushed announcements by the Public Service Board, being the Public Service Commission plus Treasury and Premiers, over the 3 or 4 days during the Christmas close down, we saw 2 instances where they were kind of yes, no, maybe in terms of kind of the return to office or working from home. But we then had an announcement made that there would be maximum working from home from the 4th of January, but that would then be reviewed on a week-by-week basis. In terms of that process, what we then saw from the employer was that it'll be reviewed weekly, and then there was an announcement made that the schools would be delayed in 2 weeks in opening. So in terms of that process, we then sought that the employer, rather than review on a weekly basis, give a guarantee that the working from home arrangements would be there until the first week of February to allow people with work, kind of school-age children, to manage their time in advance. That was initially knocked back by the employer, and because they said that they would still do it on a weekly basis. They've since made a decision that has the same effect, but has now said that it will only operate until the 6th of February, and then there'll be a transitional week, or 4th of February, and then there'll be a transitional week. What we've been seeking in terms of that process, though, is that we want to get better engagement with the employer, and so what we'll be wanting to. So I'm just going to get just having a problem with the polling. Trying to get better understanding in relation to moving towards workplace health and safety engagement around this. So rather than the employee unilaterally saying they should work from home and then then moving back towards a situation where the employer kind of determines when we should work from home or not. What we'd be seeking to do in terms of this process would then be to get the engagement from workers in relation to whether or not there should be adequate workplace health and safety consultation in relation to return to office. So in terms of this process, what we found last year was that, and the year before, that there was appropriately little consultation about when we had to take urgent action to return to to go to work from home, but there was little consultation about returning to office. And clearly, in terms of the workplace health and safety requirements in relation to this process, what we'll be seeking to do from this process will be whether members are seeking to support a process of better engagement around working from home. So in terms of that, well, I understand we're not completely clear in terms of that process. What we would be hoping that there is kind of reasonable support to say that there should be meaningful consultation. The other major thing that has then changed in terms of the last 3 weeks has been the issue of rapid antigen testing. Clearly, in terms of this, there has been a failure by both state and federal government in relation to antigen tests being available. We have significant amounts available within the health system potentially, but not enough in any real sense within the public sector. So the ACTU has been working on a campaign around this, both in terms of seeking that there be greater capacity for the community to get free rapid tests as part of a broader public health response, but also in relation to being able to have the ability for the employer to actually start dealing with the provision of rapid antigen tests in the community. So in terms of that, what we'll be wanting to get some feedback from members is, should the Together be supporting the broader engagement around the RAT test process with the ACTU? But more importantly, do you, as a kind of public servant, see this as something that we should be seeking from your employer? Because while we would be saying everybody should be getting it for free in the community, we don't think the Morrison government is going to get into that. But if we fail to win a community-free RAT test or community-free RATs, should we be seeking that the employer develops the RAT test capacity within the public sector in terms of that, but also in terms of that, whether we should be then seeking, the other thing we would then be wanting to look at is whether or not we should be having that the employer should be providing you with RAT tests, and also whether you think that the RAT test should be available for you to take home. So certainly some of the conversations have been about having RAT tests in the workplace, but in terms of that, what the suggestion has been in some agencies, and we've been talking to members and delegates about in some agencies, is whether or not it's better actually if people have symptoms that we should be seeking to have those RAT tests available for public servants, and your employer should provide them free of cost, but you should then have those RAT tests particularly available once there is actual capacity in the system. This is a theoretical argument at the moment because there's not enough tests within Queensland, but one test become available in Queensland. Whether it's something you would see as an appropriate thing for the union to argue for is that you would have a RAT test, and so therefore encourage people to take those tests prior to coming to work, rather than with people with symptoms coming to work and then being RAT tested at work and then coming home. So I think in terms of that process, that is probably the likelihood of where we would then be at the next stage of the campaign. I think the challenge with this process also, though, is that the question about the ability to win this campaign is also then going to be partly based on our ability to engage. And I think the challenge we currently have at the moment in terms of the ability to renegotiate the directive, we have very little membership indication that they think that's a significant issue. We've been using the kind of petition to try and show that there is broad support from that amongst the public service, but we've had a low pickup rate in terms of that petition. So before we engage around the RAT test process, we want to know that there is a strong support, and it's a widely and deeply felt issue within the public sector, so we can force the government to confront issues that they're not willing to confront at the moment. And so in terms of that, really the question is going to be, is there enough appetite with people online today, but also the ability to reach out more broadly to the public sector to try and say that the longer term future in relation to RAT tests is something we would support. So that is really something that we would be wanting to try and but not only assess in terms of a policy sense, but also in terms of a broader sense, make sure that there is enough membership support to get involved in the campaign so we can actually drive an outcome with the employer rather than us just trying to negotiate with limited capacity in terms of negotiations. So in terms of what that looks like in terms of the next few weeks, what we are likely to see in terms of the mandate process is, I think, over the next couple of weeks, we will see the mandates likely to be supported by the majority of members in the majority of departments. There are going to be a small number of departments, Public Trust, Cheddar, and a couple others. We don't know where that falls yet, but I think in an overall sense, I think we will see that there will be broadly a mandate across most parts of the public service as a policy sense, probably mid-February. Then there will be the question about what that policy looks like in terms of for those people who currently aren't vaccinated, don't wish to get vaccinated, looking at how do we protect and promote their rights in that process, whether that's done in a coordinated sense or not. I think there is still some challenges with agencies, particularly with the shared tenancy stuff, is going to be a real kind of potential for confusion. But I think there's also then going to be the fact that we will have been, hopefully in the next week, all the evidence is that the spike around Omicron will have diminished. I think we'll then see a further spike, a smaller spike hopefully, but some sort of spike in mid-February after we see schools go back, particularly in the primary schools. But I think that will be a smaller spike, and then hopefully by the end of February we will see will be on the back end of Omicron. And then I think the question really is then going to be, from a workplace health and safety sense, is that the end of COVID, or is it going to be a new spike in winter, either with Omicron, which has got certainly less threatening in terms of people's, there'll be less deaths as a result of Omicron compared to the potential for Delta, particularly with our higher vaccination rates. But there is certainly the risks of all other variants coming through. And while there is modelling around, I think all the modelling is having to be redriven and redeveloped post-COVID. So there's either going to be smaller spikes in winter under an Omicron environment, or where we'll see, and that Omicron might be the end of COVID at one level, if it, depending on what that looks like, but there is also just as much chance, or certainly a potential risk, that we'll see a different variant come through, which might be very different and might be much more like Delta than Omicron. But either way, I think we'll be seeing significant workplace health and safety challenges, and we need to be seeking to engage with employers on a department by department basis about exactly what their policies are, because irrespective of whether they introduce a mandate or not, the mandate is not going to, we know with Omicron, the mandate alone does not fix and does not make us safe in workplaces. So what we'll be seeking to do is to address the issue of the mandate, work out what members want in that regard, but also make sure the policies are best able to protect workers. But we would then also be seeking to establish meaningful and real consultation processes around what it takes in relation to workplace health and safety, whether that's about working from home, whether it's about the vaccination issues or not. But certainly if we do face a winter spike, or we do face an alternative variant coming through sometime in the middle of this year or in the second half of this year, We want to make sure that we are able to develop appropriate voice for workers in this and shift from the mandate debate, which has been an employer debate using their public service and reserve powers as an employer, into a workplace health and safety framework, which give workers a strong voice, but also starting to demand potentially that they do things that they don't otherwise want to do. So I think in terms of mandates, often we're sharing, members share the same view as the employer about a mandate, but in issues in relation to working from home, about ventilation within workplaces, about appropriate responses in relation to First Nations communities versus client service environments, there is still a number of questions that are unanswered, and we'll need to make sure that the answers that are developed in January and February are not necessarily seen as set in stone, but we're able to continue to have a conversation in relation to workplace health and safety, moving forward on a week-by-week, month-by-month basis, adapting and changing to what it looks like. So I know we've got some strong support from members today indicating that they will be willing to participate in a process of promoting the RAP campaign, which will be particularly in relation to the broader community campaign with the ACTU. But what we'll be certainly wanting to do is talking to people on an agency by agency basis and talking to members, both in terms of the agency consultative committees, but more broadly in relation to other processes, about how do we use the current processes to make sure that we have a stronger worker voice and make sure that members have a voice and a say in the choices that employers will be making. So we'll try and keep these monthly Zooms going for the broader public service, but we'll also, while some of this will be sector-wide and we're wanting to do issues such as the renegotiation of the directives on a sector-wide basis, I think what we do know is that those areas where we have a strong union, we will be able to get a stronger voice through the workplace health and safety processes to make sure that the challenges that we face in February, March, July and November, we're in the best position as a group of unionists to make sure your voice is heard, and you have the ability to influence the safety you have in the workplace and also the safety you have. So thank you everybody for your time today. I know we weren't able to get through all the questions that came through beforehand. We will be communicating with everybody on an agency by agency basis about the outcomes of those ballots as they come through and what happens in terms of those mandate policies. But we will also then be seeking to both coordinate centrally some of the processes around discipline to protect individuals' rights in that process, but we'll also be wanting to make sure that the mandate isn't the only time the employer consults with you, that we're able to build a strong union voice in your agency and in your department. So the issues that matter around ventilation, around working from home, around the unknowns in the future, we're best able to do. So I'm sorry that was a bit rushed and we had a few technological challenges. This is only the second time we've had to do one of these Zooms while not working from the union office, and I apologise for that, but certainly we will follow up all the questions we couldn't get to from beforehand and all the questions on today in terms of the chat we'll get to in the next couple of days and try and get back to you as much as possible. But I can say the only way we will have a strong voice in this, if you are involved, you talk to your fellow colleagues and make sure that your union in your workplace is as strong and as vocal as it can be about the issues that matter to you. Thanks for everybody for your time today. I'm sorry if I spoke too fast, and we'll move on as quickly as we can from here. Thank you.